Jefferson didn't properly sedate her, and little Nevaeh was left brain damaged and unable to walk. That was more than a year ago now. Well, now Jefferson has been charged after having her license as a dentist revoked in November. We've not been able to reach Jefferson for comment. We've been trying. We wanted to discuss this with dentist Dr. Jamie Sands here locally in Los Angeles. We're both so upset about this. And let's be clear, this is extremely rare.
It is a rare situation. There are hundreds of thousands of dental procedures done annually in the dental office under sedation.
Okay, but parents are going to worry. They're going to say, well, I have a 4-year-old that needs to go to the dentist. Do you often sedate the little ones?
I personally do not sedate the little ones in my office. I'm not a pediatric dentist, but universally,
it's not uncommon.
70% of pediatric dentists sedate their patients because you can have children with special needs, emotional or physical challenges, phobias.
Fear is a big one.
Fear is a big one. There's 35 million Americans that don't go to the dentist because of their fear.
I have a family member I won't put on blast right now. Generally, you do topical sedation, and that shouldn't be a concern.
Local sedation should not be a concern.
But because they sedated this little girl, we understand that this dentist had been reprimanded before, and in fact, the Board of Dental Examiners had taken her to task. How is a parent to know? How does a parent check you out as a dentist before coming into your office to see you?
Well, your state board will have a record if there's a pending malpractice suit against you.
And I have access to that?
You have access to that.
I can check that out online easily?
You'd have to call your state board and find out.
Most people don't do that, though, do they?
Well, they should. If you're going to put your child to sleep or sedate them, you should check the state board.
And the procedure would be to talk the parent through the procedure and what is going to happen in advance of doing it, correct?
That is, that's called consent, and you would go through the procedure prior to doing it.
And the parent would be in the room the whole time?
That depends on the practitioner.
Oh, it can depend practitioner to practitioner?
Of course, yes.
What are your final thoughts on all this? Because I know that you're as heartbroken about this situation. This little child is, she's facing a lifetime of challenges now. She went into a dentist's office and comes out worse for the wear.
What happened in Texas is a tragedy, and it's not what anyone wants their outcome to be. But sedation is an integral and important tool that we use in dentistry to treat patients. I think one thing is to check with your state board. Get referrals for dentists from friends or from family or coworkers. Another great resource is your child's pediatrician, your child's orthodontist, your primary care physician.
They'll know who's trustworthy.
They will. Professionals will know, and your friends and family will know.
Dr. Jamie Sands, a dentist here in the Los Angeles area. Delight to have you here. Thank you so much, and we send our best to this family. They're going to need a lot of love and support.